Hi, you guys. Go ahead and talk about a quick little video here about this boot that just came in. We're going to do a quick little how-to video on this boot right here. See if I can get it here in the video for you. There you go. This is a two-step dial-up cam walking boot we're going to talk about here real quick. I'm going to place it on a patient and we're going to show you how it works. It's the important part of this boot is actually right here, the dial and the little stickers that are supposed to be on the boot, which you'll see right there. We're going to talk about that real quick as I put it on the patient. There you go. So unlike the traditional cam boots, this boot, it has two bladders, and most cam boots, they either come with or without a bladder. This one comes with two bladders, two separate bladders. And if you look on the side of the boot, you can come in close if you like, there is a sticker here that says 1, and then there's a sticker on the other side that says 2. And then that correlates with the dial. On the dial you have 1 and 2, and then you have a lock. Now the important thing about this, I'm going to place it on 1 to begin with, 1 and 1. When you open this boot up, and this is a used boot because it is actually going on a patient, the one bladder is on the right hand side. Let me see if I can get in there so you get a good view. When you put the dial on 1, you're pumping this bladder. When you put it on 2, you're pumping this bladder. When you keep the pump depressed, you can put pressure on either of those bladders and you can release the air. There's also, of course, the release valve right there. And the air will come out of the bladder. Once they've pumped number 1 and then the number 2 side, which of course is the opposing side, once they've pumped it to the desired level, then you lock it and that's where it stays. And then it goes on just like any other cam walking boot. Go ahead and lift up, and you place the patient's foot in just like so. What would be optimal is if you had a nice little spare pad to put over the bend of the foot. You would put the pad in there, do the flap, do the second flap that goes across the shin, the tib fib. Now some of these boots, not only do they have the bladders, but they also have the plastic shield that comes in the front, and you've probably seen that in the other previous videos where they have the plastic shield and you do the straps over it, and then you strap it just like any other boot. You can go the double strap through the first loop and the second loop, make it secure, or you can do the shortcut strap, which is just through the first loop, and then do it that way if you're in a hurry and you want to go. And then everything's the same. You run it through, you lock it. If I may, come this way for me. You come over, you confirm that it's in the lock position, just like so, and then you're done. And cam walking boot with 2 separate bladders. All right, thanks you guys.